Hi everyone, welcome back to my channel. Um, Today I will be talking to you about grinding on young adult patient, how to catch the case before it get worse. I have a 26 years old patient came to my office today with a chip complaint. I just want to get the cleaning done. I haven't seen a dentist for a while, and he present with narrow arch top and bottom, anterior teeth crowded on the lower, and severe grinding evident on top and bottom, anterior teeth as well as some of the back posterior teeth as well. So this is almost skeletal class 2 occlusion with deep bite and super erupted up lower anterior. This is a major occlusion problem, and if the patient have not been addressed properly, she will eventually end up having very major problem. Some of the problems such as periodontal disease, severely bone loss of lower anterior teeth um, due to crowded and lack of oral hygiene, or can also have severely anterior teeth worn out and also posterior worn out, and damage not only for the ability to chew but also the cosmetics presented to her won't be very nice. She will look a lot older with her young age. At this point she's only 26 years old and she only have this much of grinding. The other problem that if we don't address this properly is not only teeth problem, gum problem, but the biggest concern would be the sleep apnea, the trouble of grinding, the jaw pain, TMJ pain. All of that come together due to the fact that the patient have skeletal class 2 and malocclusion combined. You need to treat this case seriously with looking at not only muscle mastication, but also looking at the physiology aspect for the long-term result, improve not only the aesthetic but the TMJ and the sleep problem for her. So again, when I see something like this, I make sure the patient hear me and understand me. What should you do for her, and that's what I do. What do you think we should do for her? Well, for me, I would start with the deep cleaning, get the gum healthy. After that, I would start with total comprehensive orthodontist treatment. Fix all the problem, upper narrow arch, lower narrow arch, fix all of that. Make sure she have a perfect bite, much as possible. After that, we can improve her the length of anterior teeth with gingivectomy, improve the natural looking, which I can accomplish that by simply doing the comprehensive orthodontist and as well as post orthodontist care with gum treatment. So when I do that, if I finish all of that, my vision is to fix completely the case. If after I done all of that, we need to protect the teeth too, right? So you need to have occlusal nigar or retainer to clear the bite from continued grinding. Also, you will need to again evaluate the patient's sleep pattern. If there is sleep apnea or sleep problem, we also have to be addressed that as well with the splint or the nigar that we're talking about, or even something else. So I don't want to go deep into detail, but as you can see, this case, 26 years old, female patient, just for cleaning, but now you can see how the case can be that complex. So it's so important to educate the patient as well as educate young dentists for regarding to comprehensive treatment for malocclusion and potential sleep problem, potential TMJ problem, potential gum disease. All kind of stuff can be a severely problem. Follow up my channel. Please subscribe my channel. I'll be talking to you more about the case. Thank you.